Hello students! Welcome to our new normal class. And today, let us talk about the lesson 3 in Health 7, which is the Health Appraisal Procedure. So at the end of this lesson, you class will able to, number 1, explain the importance of health appraisal procedures during the adolescence in order to achieve the holistic health. Number 2 is follow the screening procedure for scoliosis. And lastly, recognize the health services in our community. So, let's get started. When you were child, your parent, order older siblings, relatives, and other concerned adults made sure ate the right food and had a regular medical checkups, immunization, and other health care. So, ang ating mga parents natin ay laging dinabantayan ng ating food, ang ating pagkain. Lagi ang mga pagkain natin ay yung mga tama. Pinapakain tayo ng mga gulay at mga prutas. At saka lagi po tayong chine-check up every monthly. So, let's talk about the monitoring health status. So, the monitoring health status can be done through regular checkups, screening tests, appropriate for you. So, the monitoring health checkup po, our status is to check your health every month. Kung meron ba mataas sa'yo, maganda ba yung kalagayan mo, maganda ba yung paghinga mo, yung tibok ng puso mo ba ay normal. So it is very important to know your health status. For school-age children and adolescents, the school health personnel such as the school physician, school nurse, school dentist, as well as the teacher and other school personnel perform check-up and screen tests at the end or at the beginning of your classes. At the beginning or at the end of your school year. So, the school provides a medical checkup every year. So, meron po tayong mga checkups na dental or any kind of checkups. Nagdadala po tayo ng isang one whole checkups and then pinapapirma natin sa physician, sa doctor or sa school physician natin. Screening of our blood pressure is added to the routine test for height, weight, vision, and hearing. Immunization is also provided. So, pag tayo ay nag-check chine-check tayo ng mga doktor natin sa school, di ba tinitimbangan tayo, chine-check tayo ng mata, chine-check yung ating paghinga, ang ating puso kung normal po or hindi. So, as adolescents who are experiencing growth spurt may also be screened from possible scoliosis. What is scoliosis? Scoliosis is this a abnormal curvature of the spine. Yung parang yung spine mo hindi siya diretsyo. It is a parang kubet or parang may kurbado siya. Hindi siya straight. So, such as a pain and effect growth. So, addition tests may be recommended by the physician and health care provided as needed. Pag meron kang scoliosis, meron pang another test para at makita nila na kung talagang scoliosis nga yung nakita nila. So, evaluate the result of the checkup and screening is done by the school health personnel. So, the student who may need health counseling, referral, and follow-up will be identified and guided for proper action. So, as adults, you should always remember that you are also responsible for your own health. So, lagi natin alagaan ng ating sarili. Kahit na meron tayong guidance with our parents, sa atin pa rin po, nasa sa atin po kung paano nating alagaan na nating health. So, monitoring your body for change, that they will need to medical checkup, and then you need to refer as a part of this self-care. So, let's talk about the scoliosis screening. When you say scoliosis, it is a condition which is spine curve to the side. Yung spine niya, naka-curve siya into side. Nakaganito po. So, it is a abnormal lateral or side-to-side curvature of the spine. So this condition commonly develops growth spurt of adolescence. It affects girl more often. So alas po yung merong scoliosis ay mga babae po rather than sa mga boys. So this condition can be corrected if treatment early if the bones have fully development. So mako-correct lang yung spinal cord or mako-condition lang po siya before pa na mga bone natin ay fully developed pa lang siya. Pag hindi pa fully developed ang ating bone, may possible pa na dediretso po ang inyong scoliosis o ating spinal cord. The following sign should be prepared for the doctor for a treatment. Number one of the shoulder blades is more prominent. Hindi pantay yung kanya shoulder. The head is not aligned to the center of the pelvis. Yung head niya hindi aligned siya sa kanyang pelvis. Para hindi siya centered. Ang hips appears higher is more prominent than the other. So pag hindi pantay ang kanyang shoulder, hindi rin pantay ang kanyang hips. Ang ribs niya ay uneven. Ang waist niya ay uneven also. The entire body is lean to one side. So ang ating katawan ay para nakalinya sa in one sided lang siya. So in this school, your school nurse or the health teacher, me, can do the scoliosis screening test. So during this test, the school nurse will observe your posture. Siyempre para malaman natin kung ano yung sign ng scoliosis para ma-detect natin earlier. Kasi ano ba sabi ng sign ni scoliosis? Number one is hindi pantay ang kanyang shoulder, ang pelvis. Ang kanyang katawan ay one-sided lang siya. Ang kanyang rib cage and waist are uneven. Here are the screening procedure. So, forward bend test na tayo. So, number one, stand facing away from the screener. So, stand facing away from the screener. Bend forward at the waist 90 degrees. Feet 10 centimeter apart. Knees straight and feet parallel to each other. Palm on the hands are facing each other. And arms hangs down and are relaxed. And the head is down. It is a normal if the screener observe of the following. Letter A. So both sides of upper and lower back are symmetrical. Pag nakita niya na symmetrical lang yung upper and lower, wala kang scoliosis. Hips level and symmetry also. There is possible scoliosis if the screener observe of the following. One side of the rib cage or the lower back showing uneven symmetry. Hindi po balance ang kanya rib cage tsaka yung lower back. Curve is the align of the spinal. So makikita mo agad yung spinal niya na parang nagka-create siya ng curve. It is very important that you are aware of changing your body. So, aware tayo sa mga nangyayari sa ating katawan. Kung meron kayong kakaibang nangyayari sa inyong katawan na ipagsabi sa inyong parents o sa mga teacher itself para may screen kayo kung ano ba yung nagbabago or ano ba yung nakikita nila dun sa katawan ninyo. Don't be afraid na sabihin na meron kang anumang mga nararamdaman at least para maagapan at may check up ka or may dala ka sa clinic. So, let's proceed to the health services. When you say health services, they are the public services provided by the medical care. So, marami pong mga health services na makikita natin or makikita natin dito sa school or even in our community. Health services consists of medical professionals, organization, and healthcare workers or provides medical care to those in needed. So, yung mga health services serve as the patient, families, communities, and the population. So, they covers emergency, preventative, rehabilitative, long-term hospital diagnosed, primary, palliative, and home care. So, our government believes that the strong nation helps a healthy citizenry. Tama po. So, kaya po kailangan ngayon pong pandemya ngayon, mas kailangan po ang ating health kesa sa anything else. Okay? So these are the primary healthcare programs in the school and the community. Number 1 is the dental health program. Conduct dental-related examination and procedure, just like the teeth, dental. Pagtanggal ng ngipin na sira, pagpasta, pagbe-brace. Diyan po ginagawa sa dental health program. Medical morbidity clinic. So, provide free medicine for simple health problems prescribed by the medical practitioner assigned in community or the school, such as lagnat, ubo, or any simple or parang mga simple na sakit lang po. Next is the child health care for the children. Conduct immunization of children since their immune system is really weak. So they are vaccinated by measles, polio, and influenza. And also, itong services na ito ay for the children. Next is the nutritional program. The nutritional program administered offering timbang to ensure the children mass is appropriate for their age or the BMI or the body mass index. So, in here, the nutritional program, kung bang balance ba ang ating weight tsaka height, kung normal ba siya, kumakain ba tayo ng tama. Deworming. This services aims to eliminate intestinal parasite in children. Ito po yung pagpupurga po ang tawag natin dito. So, ang pagpupurga po ay every January and July, the National Deworming Month. School feeding. School feeding, these services aims to improve the nutritional status of the student by providing a free, healthy food or meal. Dito, applicable lang to sa mga malnourished. Next is the medical checkup, check and inform children of the general health status, such as check your height, check your eyes, check your inhale and exhale, check your heart and everything. Next is the mental hygiene. In the mental hygiene provides center for adults suffering from problems like depression, abuse, and stress. So mostly the students are experiencing depression and anxiety for many reasons. So ang pinaka solution lang dyan is please share your problem to your family and your friends so that they will help you from that problem. Blood testing. In the blood testing, we will check and test component of the blood for possible disorder or condition like the anemia, leukemia, and the blood infection. So, meron pa silang i-check yung blood mo kung meron ka ba sakit na pneumonia and blood infection. Pharmacies and services. Ito po yung mga nagbibigay ng mga gamot sa mga local communities. So, let's health check. So, the health check title is Organize What You Know. So, the graphic organized below shows that the importance of the health appraisal screening test in attaining holistic health. So, draw an arrow connecting to the screening test to its importance. So, you need to connect the services test and the services to their purposes. So that's it for today. So good day and